coming off antidepressants for me has been extremely hard. 4-month period where I was non-functional. So I couldn't go to work. I couldn't look after my daughter. My husband had to do everything. For me, it's been very difficult to get off. I wonder if I'll ever get off them. But I think for me, had I known personally, I wouldn't have started them.
Imagine being a mental health nurse, fully trained and following the guidelines you use every day to care for patients, guidelines you trust implicitly. This was Laura's reality at age 26, when she was prescribed fluoxetine for mild stress and shyness in the workplace. The same nice guidelines she diligently applied in her practice assured her that these drugs were safe, easy to take, and easy to taper off. But the reality, quite different. Initially, these medications made her feel worse, uncomfortable, but after doubling her dose, the emotional numbness set in. Not a cure, but enough to function. 8 years passed, and she found herself in a happy relationship, but struggling with emotional blunting and a deteriorating sex drive. She decided to taper off, just a 4-week process, as she had been told. Perfectly safe. Her life spiraled out of control. Intense anxiety, severe symptoms, and she even questioned whether she had a serious anxiety disorder. Demoralized, she went back on the meds and resigned herself to a lifetime of coping with these side effects. Fast forward another 8 years, and Laura decides to try again. This time, suicidal thoughts, relentless akathisia, unable to work for months, and barely able to care for her daughter. Her family rallied around her just to help her survive. How can something like this happen on medications that are meant to be safe to taper off? And how does someone responsible for handing out these meds every day grapple with a personal experience like this? And where does Laura's story end? Stay tuned to find out. So Laura, tell us briefly, how did you get started on psychiatric medications in the first place?
Yeah, so it was basically for some sort of work-related stress at the time. It was more like the environment. So I went to the GP and was prescribed citalopram medication for that. So there was no actual mental health problem or anything like that. It was just sort of work-related stress. So I started on this medication in about 2010. I've been taking it ever since.
Gosh, what was going on in your life at the time to lead to those stresses?
Yeah, so it was a busy kind of working environment. So I work in mental health. It was just a really kind of stressful job. I don't believe there was no underlying kind of mental health illness. It was just basic work stress. Probably what I should have done is maybe take some time off but you know, I accepted the medication. You know, I take responsibility as well. And that's
how old were you when this happened?
So I was about 25, 26 when I started on citalopram medication. Yeah. Okay. So a long time ago.
Yeah. So you're fairly early in your career. You're having some work stress and you go and see the doctor and they say, hey, you know, take some citalopram. How did you feel about that at the time? Kind of hearing that when the doctor was like, you know, I've got this prescription for you. It's an antidepressant. Do you recall what that felt like?
It was something I kind of heard of through kind of working within mental health. So I do take responsibility. I booked the GP appointment. I knew there was a medication. So I went kind of, you know, asking if there was anything to help. I knew of this medication that, you know, I worked in the environment and I said, you know, I'm stressed at work. I'm wondering if I can take this. I didn't really know a lot about the medication myself at that time. I knew it was an antidepressant. I knew it could help anxiety. It probably was maybe a but probably more shy. It wasn't, you know, a mental illness, but it was just something that I thought might help at that time, but had no idea, you know, of how how difficult it would be to come off.
So when you saw your doctor, I mean, did you think you had like a chemical imbalance? Like what did you think the drug was doing like when it was presented to you at the time?
I thought it'd be something that I could take for a few months whilst I was in that workplace, that I would be able to get off. And, you know, I think at the time, you know, the nice guidance, you know, was that you can get off this medication in a few weeks, you can taper. So I had that in my mind that, you know, I'm going to be able to get on this medication, you know, in a few months, a year or whatever, I'm going to be able to get off this medication with no kind of repercussions. I didn't have any kind of information on the side effects. Of course, there's a leaflet. You know, I didn't really read that. Maybe I read through it a little bit, but I didn't really understand, I guess, which sounds silly because I'm a mental health nurse, but it, you know, you think of like the benzodiazepines, there was so much information on those and they are really habit forming, but that wasn't kind of known at the time, or certainly I didn't know that.
Well,
and
I wouldn't blame you for that.
And
it doesn't sound silly to me because, yeah, I mean, you're a junior nurse and, you know, you recognize that you're depressed from work-life stress. And then you decide to follow the guidelines is essentially what you did. You said, you know, these are nice guidelines. And they say, you know, when you're depressed, you can get on these medications and they're fairly safe. And so, you know, it wasn't like back then, at least, there was this big warning there saying, you know, these can be impossibly difficult for some people to get off. And so I think a lot of people end up in that position where they it just seems like a perfectly reasonable and safe thing to do.
That's exactly how it was, actually. Absolutely. It was, yeah, mild stress. I'd say my mood was fine. I've always been a very kind of bubbly, sociable person, get on with most people in the workplace. It was just a busy, stressful job. And yeah, and I knew about these medications. There were certain, you know, in the field that would say, oh, these are really good. And so I went to the GP and asked for a very small dose of citalopram. And over the years, that dose got increased.
Yeah. Well, so tell us about it. I mean, after you started it, was it helpful to take?
So I started on 10 milligrams, and I remember, it's a long time ago, but I remember feeling more anxious, if anything, really quite anxious. And I think then I thought, this isn't working. So I upped it to 20. I went back and upped it to 20. And I think probably after a couple of months, the way I describe it is it numbed me. It numbed, which, you know, could be useful in a really difficult situation for somebody short term, sure. But it kind of, yeah, that's how I can describe it. And I'm still taking an SSRI at the minute because I've had difficulties getting off. But yeah, it kind of numbed me over the years. Okay. That's how I describe it.
So walk us forward from there, because eventually you try and come off these medications. So tell me about that decision. What was going on with the medications to have you reach a point eventually where you decide, it's time to come off?
I think the first attempt was around about 2014, 2015. I'd started a new relationship, and I was very mindful that I was very kind of emotionally distant from that relationship. I can actually recognize it now, still being on the medication, but my sex drive had pretty much gone. So I kind of recognized these things, you know, and it was a few years down the line. I'm in a less stressful job. I'm older. I'm a bit more confident. So I tried to get off in 2015. Again, I think I tried to do it over a few weeks. And yeah, was just hit with a kind of surge of anxiety, worse than anything before the medication. So I went back on it.
And
And the last
what did you think? What did you think had happened when you couldn't get off? Was this? Do you think, it's my underlying condition? This is my depression coming back? Did you know it was withdrawal? Like, how did you understand that this drug that was meant to be easy to come off, you couldn't get off it now? How did you make sense of that?
So this is where it's so confusing, because I have a sense of who I was before, and I've been on this medication for many years now, and I can see slight changes. But it was confusing, because I kind of didn't know, is this me? Is this anxiety, or is this withdrawal? But in 2014, I didn't know anything about withdrawal, and I don't think there was too much out there. So I thought, no, I've got an anxiety condition. I'll go back on this medication. I don't believe that anymore. I don't believe I've got an anxiety. I'm a shy person, but I think we medicalise too much.
Okay, so this happens. You think, I can't come off. I have an anxiety disorder. Now, did your doctors reinforce that? Is that what they said, or was this something that you had just learned? Because I being a mental health professional, I know that's very commonly said when people have increased symptoms during withdrawal. Often when I was a psychiatrist working in the traditional place, if someone was symptomatic off the drugs, we'd always just say, oh, they're just non-compliant with their medication, and now their mental illness is untreated. So tell me about that. Was this something that you had thought that, I have an anxiety condition, or did someone tell you that when you struggled to come off?
So it's just something that I kind of, I guess, thought myself, that I'll keep taking this medication. I maybe thought over the years it's probably something I need. I didn't anticipate that it'd be hard to get off. When I went back on it, failed attempt in 2015, I went back on it and just thought, well, I'll just stay on this medication indefinitely. So I kind of resigned myself to that up until last year, 2023, when a lot more was coming out, the cogs were going in my head, and I like to think of myself as a really balanced, rational person, and I thought, actually, no, this is the withdrawal. This is, I do believe my brain has adapted to this drug, absolutely. So my thinking has matured now. So yeah, when I tried to come off last year, I was more aware that actually, no, there's no, yes, there are times when I get anxious, but that's part of personality. And I know I would argue there are lots of, slightly maybe socially awkward people, or more kind of extrovert people. That's kind of, to me, part of being a human. So I sort of knew last year that actually, no, there's nothing wrong with my brain. I absolutely don't believe in chemical imbalance, and I don't believe there's any evidence to support that. So my thinking's changed, and I'm older and wiser, I guess.
What was the moment where you shifted from being, I have an anxiety condition, and I just have to take this medication, I have to deal with the emotional distance and the sexual dysfunction, this is my lot in life. Do you recall whether it was something someone said to you, or an experience you had, or something that you read, when you started seeing maybe the chips in the paint, and you were just like, well, actually, I don't think that's the case. Well, what was the turning point for you?
So it was lots of different things over time. So one thing is, I remembered, so I started on the medication at 26. So I used to think back to when I was a child through high school, and I thought, I had breakups, I had things at school, and I always got through it. I always got through things. So that was part of it. More was coming out. So I started to think, these medications may well be causing some kind of physical dependence. So it was lots of different factors. And also, in the birth of my daughter, I wanted to kind of get connected again. It's quite confusing because I know I'm still me and my personality is not altered, but I do have a sense of who I was before, who I am now. And I wanted to get back to that because there was nothing wrong with me in the first place. And, this is not me blaming anybody, but what I will do is speak out about it, and actually say, it's been hard trying to get off this medication.
Well, what I'll say is, just to say the least, because I do know, from when we were talking before, you had mentioned that sometimes the withdrawal was so bad that you even had almost withdrawal-related suicidal thoughts. Was that on the first withdrawal, or was that when you tried to come off in 2023?
Yes and no. This was 2023. I'd started my taper. It was about July 2023 last year. I did it over 4 months. Again, too quick. So I finished my taper in November 2023. I was okay, probably for about 6 to 8 weeks. In fact, if anything, I noticed my mood went quite good. And you see, this is where I think people are misdiagnosed, because I almost felt like my brain was trying to rebalance. So I had a 6 to 8 weeks where I felt really, really good. And then absolutely textbook. So I came off the medication in November last year, and by February, March, I said to my mum, I've crashed into the worst depressive state of my life. Nothing that I'd ever had before. I was always a very positive person. It was, and then, the suicidal thoughts came, and I knew what they were. I knew what was happening. I tried to ride it out. But I think because I'd done it so quick, I kind of feel my nervous system was so destabilized that I kind of put my clinician head on, and I thought, right, my body or my brain is missing this medication, this drug. So I knew I had to get back on it, which I did.
So after you got back on the fluoxetine, did the suicidal thoughts go away? Yeah,
so I initially reinstated the original medication drug, which was citalopram. I gave that 4 weeks. The suicidal thoughts went very, very quickly, but I couldn't seem to stabilize on it. So I tried another medication. I tried duloxetine for a week, but very quickly realised that my long-term goal is to get off an antidepressant. So with my psychiatrist, who was a very, very good psychiatrist who listened to me, we decided on fluoxetine, SSRI, and I did stabilise on that. It took away the really severe symptoms straight away, but for everything else to kind of settle, it took probably about 10 weeks. I remember initially just crying all the time. I was just crying when I first went back on the SSRI, but I knew I had to ride that out to get my brain back to a kind of level.
I'm going to jump in here because I will ask you to describe the texture of the symptoms you had, but this is a great time for a little teaching point here. So what happened to you is textbook. In fact, you said that. What we see very frequently in people coming off antidepressants after long-term use is after they take the last dose, they have this honeymoon period sometimes, which can be, up to 3 months. I've seen it go a little bit longer sometimes, but a lot of people will describe feeling like they're through the worst of it and things are okay. And then 3 months later, the bottom falls out and they get hit with severe withdrawal symptoms. It can feel very different from depression. I mean, some people have this kind of intense anxiety that almost feels like a chemical anxiety. I've heard people say they feel like they've had poison poured into their brain because they cannot get away from the intense anxiety. It's the most common symptom I see of these protracted antidepressant withdrawal reactions. And some people even have neurological signs like ear ringing, light sensitivity, tingling in the hands and feet, and also gastrointestinal problems. And it's really, really confusing for everyone because you think you're okay. You know, it's been 2 months since you've come off the drug. So no doctor thinks it's withdrawal related. And so these people, they end up, you know, they're going on a search for what's happened. But that is textbook. That is the textbook presentation of protracted antidepressant withdrawal. And so thank you for describing that. I do want to ask though, Laura, I want you to bring it a little bit to life. What was it like when those symptoms hit you 2 months later? Because they're different from regular anxiety. And I was just wondering if you could use your experience to kind of paint what that is like to have that happen.
So I'll speak honestly. So this was my experience. So it was like an internal terror, fear. I remember messaging my parents saying I'm frightened, but I didn't know what I was frightened of. So it was I don't know whether it was like aphasia, but it was like an inner terror, very kind of restless. That's how it felt, and it lasted. So once it hit, it lasted through most of the day, and then it would ease off a little bit in the evening, and then it would come back. Absolutely, yeah. That's what happened.
And you had mentioned that you were having some suicidal thoughts at that time. How did you know? What was it about the thoughts that made you know it was withdrawal related, and this wasn't some underlying mental illness bubbling up? What was it that allowed you to figure that out?
Because I'd never had that before. I'd never had a depressive state. I'd never had any intense suicidal thoughts, and they were really intense at the time, quite sort of intrusive like, and I knew what I was like before, so I kind of hung on to that kind of, you know, this isn't me, you know, this isn't something that I would think, or, you know, I think feelings of hopelessness are very real to people, so that's not to undermine suicidal thoughts. But I knew it wasn't me. Yeah, and I almost went into like a kind of catatonic state. Yeah, it was hard, and it's really hard for my family as well. That's, you know, for them to kind of watch that kind of experience. But I'm lucky they believe me as well. I can't, my mum, my goodness, she knew.
Tell us a little bit about what this does to someone's life. You know, when you're working and you're going through this, and I mean, you may have been in a relationship, I'm not sure. How does it affect your life when you go into a protracted withdrawal state?
Okay, so for me, probably about a 4 month period where I was non-functional. So I couldn't go to work. I couldn't look after my daughter. My husband had to do everything. He worked as well. My mum had to come and help. So it had a huge effect. And I'm really mindful when I'm speaking, because, I don't want to say that people should be frightened or they shouldn't go on. I think people need to make their individual choices, but we can prevent this from happening and now we have proper guidance, and there are people out there like yourself who have taper clinics, and that is a good thing, because, although what I'm describing, it was really scary, and the last thing I want to do is scare people, but actually this is a positive, because now, I'm very optimistic in a year or two when I have the courage, because it has traumatized me, to come off on it. I've worked out I've got Dr. Mark Horowitz's book. I've been in touch with him, and I know myself it's probably going to take me about 2 to 3 years, probably max, to come off. And I do agree with that kind of slow, patient-led taper. So I'll do that myself with the GP. So it's not to kind of frighten people, because this can be avoided. I came off an SSRI, I've been on it for 10 years. And I came off in 4 months. And for me, and I would suspect the majority of people, that is far too quick. So actually, this can be avoided. Now we know what we know. This is real, and I wonder in years to come. Yeah, it's although it was a very hard experience, I feel that it's been a huge kind of learning. I've got that insight now. I've kind of been armed with this. Actually, I can get off this medication, but it's going to take me a couple of years.
Okay.
And people, just be careful, do it slow, listen to your body.
Are you doing okay now?
I am, yes. I'm back at work. My nervous system has settled down. The akathisia is gone. Absolutely fine. This is something I speak about with my colleagues very openly. And if I do feel, if I didn't have my knowledge, I could have been easily just, misdiagnosed with, because I was so restless. I mean, it could have been like an agitated depression, and that's kind of what I want to speak out about, just to question. But I'm absolutely fine now.
So going back to, actually, let me ask, how long were you off work with the protracted withdrawal injury and the akathisia?
So I was off work. When did from March, and I went back in August. So I went into protracted about February, and I went off end of Feb, beginning of March, and I was off for 4 or 5 months from my job. And I was very open with them. I thought, I'm going to speak out about this. I think there's always a worry, I think, of speaking out that, that kind of be labelled anti-medication, but actually it's not that at all.
And what was it about the symptoms? What was it about the symptoms that made you unable to work?
So it was the level of kind of agitation and the terror that was just sort of consistent through that period. And then wasn't just my kind of gut health decline, so I lost quite a lot of weight. I had quite a lot of what probably would be labelled IBS, but it was, I can only assume it was serotonin related. So I'd lost a lot of weight, and my colleagues, I looked, looking back, I looked really unwell. Yeah. So I couldn't work.
So you're back at work now. How has this experience shaped how you see antidepressants being used in just day-to-day mental health practice in the UK?
Always try and come in with balance and informed consent. So I think, they are overprescribed in a lot of cases, probably for kind of general life ups and downs. I think, we overdiagnose to a certain element. I'm not saying there's not a role for medication, and I'm certainly not advocating anybody come off their medication if that's what's right for the person. But if the medications are going to be prescribed, then people need to know how we de-prescribe them safely.
Yeah, I mean, they need to hear that if you take this medication long term, your brain is going to become dependent on it. And we really can't predict whether it's going to be easy or hard for you to come off. Some people are going to come off easily, but some people, when they come off, they can develop literally a neurological condition, kind of like a brain bruise that can take you out of work for 5 months, give you IBS, put you in a state of agitation where your family has to rally around you and care for you. And unfortunately, because our clinical trials are so short, and we don't study this, we don't know what percentage of people will have these difficult withdrawals. We don't know whether there's genetic risk factors or just characteristics of people, whether it's their age or their sex, that predispose them to having these difficult things. And so it ends up being like a dice roll. And I think these are the uncomfortable conversations that we don't have with patients getting on these medications, because that's a serious risk. And for many people out there, even it's a serious enough risk that it would put the finger on the scales and maybe tip some people away from not taking these medications unless they absolutely needed to.
I've thought about this and, whether to say it, but I think for me, had I known personally, I wouldn't have started them. That's my situation. I think, if somebody's extremely depressed, and they've had awful things happen and they're just not coping, there is a role there. So for the balance side of things, but like you say, people need to be told about, there's so little that we know about long-term use. And what I've found out through long-term use is, for me, been very difficult to get off. I wonder if I'll ever get off them. But I'm reasonably young. I've got my insight. I've got my taper plan, and I'm hopeful that I can. But it's just having those conversations so that people can make the right choice. Kind of like risk and balance. I had a mild bit of work-related stress. But okay. I wouldn't want to say people shouldn't take them, because that's not sort of right for me to say, but we need to talk about the risks as well, and not feel worried or like we shouldn't do that, because that's what that informed consent is about.
Good. Well, Laura, I want to thank you for coming on and sharing your story. Hey, thanks for watching. If you're interested in learning more about what depression is, check out this video here. And if you're interested in learning about the research supporting their use, check out this link here.